Good evening, everybody. This is Christian Behr, and tonight I'm presenting on behalf of Dirigo Safety LLC out of Auburn, Maine. And we're here tonight talking with some subject matter experts on the SANE kits and how they're used in the state of Maine, how they're processed, how they're put into the system, how the hospital deals with a SANE kit, and then the crime lab and the law enforcement part of that. So I'll actually let everyone know quickly that the board that we have tonight talking is a group of what I would term experts. Alison Gingras from the Maine Crime Lab, the Maine State Crime Lab in Augusta, and Keri Kapaldo from St. Joe's Hospital in Bangor. And myself, Christian Behr, the three of us are actually board members of the Maine State DHHS Safe Board. So we all have a various seat on that board. And I'm going to start with introductions. I want to introduce to everyone first, Alison Gingras.
Thank you. As Christian said, I'm Alison Gingras. I'm a forensic chemist at the Maine State Police Crime Lab. I have approximately 25 years experience here. And my current assignment is with the state's cold case unit, but I also am very invested in the sexual assault testing that happens here at the lab. Guess that's about it for me.
Awesome. Well, I appreciate that intro. We'll get back to you in a second, Allison. And next, I'd like to introduce Keri Kapaldo. Go ahead, Keri. Tell us a little about your part in this.
Keri Kapaldo, and I'm a nurse. I like to just say that straight out. I'm a nurse, and I've been a nurse for 11 years. I work at St. Joseph Hospital in Bangor, and I'm also what's called a forensic nurse or a safe nurse. And I oversee a program of fantastic safe nurses, and we take care of people who've been hurt by others, specifically sexual assault patients.
Awesome. And by the way, happy Nurses Week.
Oh, thank you.
And with that being said, my name is Christian Behr. I work part-time contracting with Dirigo as the social media and a media manager of sorts. However, my full-time career is as a law enforcement officer. I spent 25 years at the Augusta PD, where I retired in 2020, and then I went to the district attorney's office in Kennebec to do investigations there. And as a result, I've been on I was asked to join the SAFE board a couple of years ago. I'm almost at the 3-year limit that we generally do, but a lot of people will extend that 3-year time on the board as the law enforcement liaison, which essentially is a big part of the job that I do at the DA's office, which is providing follow-up investigations, but a lot of information on how law enforcement agencies work within the state of Maine. And so on the board, I do a lot of speaking to the various members of the groups, and all three of us have been involved in the sex kit tracking initiative, which has passed the House and Senate and been approved, I believe, this week for a fiscal note to be able to provide that service to all of our survivors and law enforcement agencies, the crime lab, and the state of Maine in general. So that's really a big win for everyone here in Maine. So with that being said, we're going to talk about sex kit tracking tonight and essentially sex crime kits in the state of Maine and how they're handled. And I know they emanate out of the crime lab. So Allison, if you're ready, why don't you pick it right up and tell us what happens with the kit?
Sure. So it all begins with the crime lab requesting kits from the manufacturer. And currently, the manufacturer that we use is Searchy. We order kits in batches of 250 to 500 at a time. And basically, the kits are legislated. Everything that's in the kit is standardized. And that cannot be changed without a process called rulemaking that has to go through the whole legislative process. So these standardized kits are built by Searchy, and they'll ship them to us on pallets. And the kits, I have a kit here. This is one that was damaged in transit. So
the big box.
Yes, it is. And if you see down at the bottom here, I trying to focus in, but it's hard to see.
Yeah.
Each one of these kits has an individual tracking number, and that's a unique identifier. The tracking number is on the outside of the box, and there are also stickers on the inside of the box with that same tracking number. And that number follows the kit from the time it arrives here at the lab, and through the whole process of collection, and then when it's returned to the lab for testing. And this is how we track where that kit is or what happens with that kit. So when the crime lab gets its order of 250, all of the numbers get entered into the system. And as a hospital orders kits from us, we ship them out. So generally, we order about 500 kits a year, and we distribute about 500 kits a year. About 100 of them go toward training. So the nurses that do the collection process, the specialized training that Keri can talk about. And as part of that training process, they need to actually utilize some of the kits. And about 400 of those kits every year are distributed to different hospitals for collection purposes. So at that point, at this time, we don't have any way of tracking the kits once they leave the lab. Once they come back, they're submitted for testing, then we also continue to track what happens with the kit. Part of the legislation that Christian was talking about, which would be LD 2129, provides for a tracking system which would actually track the kits every step of the way. So from when the lab sends the kits to the hospital, when the collection happens, when the kit is collected by or picked up by law enforcement, when it's submitted to the crime lab, and then potentially, what happens after that.
Yeah, now when that system hopefully gets stood up in the near future, that's something that the Maine Crime Lab will actually have a lot to do with, correct?
That's correct, yes. This legislation provides for personnel that will actually maintain that system.
Awesome. I think it's a good time now too to talk to Keri. And let's say the kit that goes out from the crime lab to all the hospitals in the state of Maine is now essentially in your hands. What happens then?
So that's a double-edged sort of a question, right? So every hospital has kind of a varying response to sexual assaults and capacity to maintain them. And some hospitals don't even have safe nurses or a sexual assault nurse, and some hospitals, the ER nurse takes care of the patient. Sometimes the manager is the person that orders, or maybe an educator, and everybody will have their own process of how they intake their kits. There's not often a lot of record keeping along with that either. I think it's a process that's not really well known on how to handle it because we don't have this kit tracking system yet. And then hopefully once that happens, we'll have standardized education and training for everyone, and then we'll have this nice, smooth process. But so we have the kits, so we get them to the hospital some way, shape, or form, and they're available for patients that present for a sexual assault exam. I'm going to share my screen just so I can show what happens at the hospital.
Perfect. And yeah, Keri's going to share a slideshow now with what goes on from the nurse's perspective.
And I lost. Here we go. Lost one screen, opened the other one.
Awesome.
Okay. We have PowerPoint visual, right?
Yes.
Okay, wonderful. So I mentioned the safe nurse or sexual assault nurse. I think it's really important to know what that means. The technical definition is that we're healthcare providers who are specially trained to provide comprehensive care for the sexual assault patient, and we demonstrate competency in conducting a forensic exam, which includes that sex crimes kit and collecting the evidence that we put inside. And we also have the ability to be expert or fact witnesses in court. The other thing that's really important to know, especially in the state of Maine, is that it doesn't have to be just a nurse that it can fulfill this role. It can be doctors, physician assistants, DOs, kind of any other type of advanced practice provider can also perform these exams as well. The other thing that's really important to know is that all of our care is rooted in something called trauma-informed care. And this plays a big role in what the patient decides to do, including that sex crimes kit. And the biggest thing is that we collaborate with them and we follow their lead by being empathetic and compassionate and helping them make the decisions that they're going to make in their care. And so the next slide is what all of those options are for them when they come to the hospital. So consent is a big portion of what we do, and they may consent to the medical exam, they may consent to coming to the emergency room, but when it comes to the sex crimes kit, if they opt in for that evidence collection, there's another layer of consent inside the kit, and they do have to sign written consent. We hope that they will be cared for by a safe nurse or a safe in training, if not an ER nurse or other advanced provider like a doctor. All of our sexual assault patients, the goal is across the state to have an accompaniment from a sexual assault advocate with them, that they're engaged in community resources that can help them with the process and what happens after they leave the hospital, and maybe help them navigating what happens to their kid as well. We also obtain medical history and medical forensic history, which would include the narrative of the assault, what they say happened. We use that information to guide our exam and our assessment, and also what evidence may be potentially collected in the kit, or if we can collect evidence. Maybe the time frames don't match or are outside of our guidelines. Maybe the types of assaults that are reported lead us in a specific direction to collect only that type of evidence. So if there's only an oral assault, we would, need to only collect oral swabs versus vaginal swabs.
And the same, the same would go for if they indicated maybe a date rape drug was used or some other kind of.
Right. So we're not going to always collect urine, but if they mention memory gaps, drinking, possible drug use, then we would collect blood and urine. So that history is really imperative on what injuries to look for, but also what evidence we could be potentially collecting. Obviously, interventions and treatment for injuries and pain that they may have. We offer medications to prevent pregnancy, HIV, and other common STIs. And then obviously the evidence collection, right? State of Maine Sex Crimes Kit. And this is, like Allison said, she showed you the box. It's full of envelopes and Q-tips, and we have very well trained in the collection of this evidence. Fresh set of gloves every time we touch something, no bare hands, mask on, all the things. And the best part about the kit, I would say, is that it is very much survivor led. And just because we open that box doesn't mean we have to collect everything that's in it. It's really what's applicable to the patient and what the patient wants us to collect or is okay with us collecting.
So have you experienced, I have to interject, have you experienced
Sure.
patients who have, you indicate, hey, that's something we would probably want to collect, whatever it may be from the kit, and they just, no, I don't want you to go there or do that or take that?
It really, it's a more of like a conversation. And so when we're going step by step through the process, so like next up, we have a swab of the external, like outside of your genitalia.
Yeah.
This is the reasons why we would want to do that. Are you okay with us doing that? Okay. And then, yes or no kind of thing. We wouldn't, obviously if there's something that isn't relevant to what happened to them, we're not having that conversation, but anything that is relevant. So may I do, swab your nails, things like that.
Yes.
Other things that we have to kind of think outside the box on sometimes is maybe in their history, they mentioned something like a bite on the breast or kissing on the neck. And we would want to do an extra swab or miscellaneous swab of those areas to possibly collect, saliva, other types of DNA. So we're really paying attention to the little nuances and information in the history to really know what other things that we need to be looking for on their body.
Yes.
Once we complete the kit, we relinquish custody immediately to law enforcement. So once the kit is collected, the patient leaves, we still have a lot of work to do with our kit. So all of our evidence has to be dried, or it has to be packaged, especially if it's wet and remains wet. And we have to package everything individually labeled. Everything has the individual sticker with the kit number on it that Allison mentioned. And, we put it all back in our box and everything's sealed up, and paperwork that comes with it as well. The paperwork is really important. There's the consent form, but there's a paperwork that kind of summarizes the history of the assault or the nature of the assault, kind of what went where and what touched what, summary of events. Also some information around, like, did the patient shower, change their clothes, drink or eat, things like that may affect potential evidence or add to evidence, like have they had consensual intercourse also in this time frame. So we also have a checklist in the kit of everything that we collected or didn't collect, so that it correlates with what's in the box. Something else that we can do is forensic photography. So that's not included in the kit. That is separate. It's maintained at the hospital. The kit is always relinquished to law enforcement and is not maintained at the hospital in our state. And then, of course, we always want to make sure that there's good follow-up care and safety planning. And part of that is, hey, this is what happens to your kit and where it's going to go. If they haven't reported to law enforcement and they want to report to law enforcement, we help assist with that if that's what they're looking for in that moment. And of course, we always are bound by our confidentiality of being mandated reporters, and that's a really important fact just throughout the whole process of our exam.
Yes.
So once we complete our kit and we've packaged everything and it's all dry and the patient's long gone, they have made the decision while they are with us to either report the sexual assault to law enforcement or have already reported it, or to not report it. We call this an anonymous kit. So on this little flow sheet I have here, so the kit is completed, and if they opted to report to law enforcement or had already done that, then the law enforcement agency with jurisdiction of the site of the assault, where the location of where the crime occurred, they assume custody of the kit. So if it happened in Augusta PD has to take the kit. Now, if a patient says, I'd like to have evidence collected, but I don't want to report right now, or I'm unsure if I want to report, they remain anonymous. So those kits go to the jurisdiction of the law enforcement agency where the hospital is. So for me, I'm in Bangor, so Bangor PD takes all of our anonymous kits. And then both, regardless if they're reported or anonymous, have to be retained by law enforcement for 20 years, which is a rather new time frame on our statute that has changed. This is the third change in my 10 years of being a forensic nurse. Was 90 days when I started, then changed to 8, and now we're at 20 to match the statute of limitations for reporting the crime as well. The other difference between a reported and anonymous kit is a reported kit will have the victim's name on the front of the box. An anonymous kit will not have their name on the front of the box and is only identifiable by that kit tracking number. Regardless of what option they have, the patient leaves with information on a card that has the kit number, the kit tracking number, the law enforcement agency that has the kit or that it has been relinquished to, the safe name, the hospital that they received care at, just in case they forget. There's a lot of stuff happening in that moment and a lot of trauma, and they can easily forget some of those details. So we ensure that goes out the door with them as well. And then as far as the kit goes, once we discharge and we send off that kit to law enforcement, hospital staff rarely ever really know the outcome of what happens with that kit, if it ever goes to the crime lab or gets processed. Because right now, as Allison said, we don't have this kit tracking system. So that's also a hope that will come out of this legislation, is that we will be able to see where things are in that process. but more importantly, survivors will be able to see where their kids are in that process.
And you know, it's interesting that last statement about survivors being able to see where their kit might be in the system. I think we know as a group of either one of you, why is that so important?
I think it just gives them a little bit of sense of control and understanding. And when it, like, they had it done, they went through this, you know, traumatizing process and a traumatic experience. They come to the hospital, they relive some things, they tell their history, their experience. They get, their body becomes evidence. It's a site of evidence, and it's just a lot, right? And then they leave, and there's all this unknown for them. It also takes the onus off of the patient from having to track it down, right?
Yep.
They don't have to call law enforcement and say, what's going on with my kit, or, you know, did anything happen with it, or where is it? They don't have to try to get an advocate to help them get connected with law enforcement if they don't feel comfortable doing that on their own. It just kind of takes all that responsibility off the patient, and they just get to log in and see where it is and have some reassurance that it's in the process or somewhere, you know, in the spectrum.
Yeah, and I agree with that 100%. I think a lot of the dialogue that we've had over the last year or two, leading up to obtaining this legislation finally for sex kit tracking, part of the conversation, and I think it was either talking with the folks from Joyful Heart or maybe some of the other folks who were part of the Detroit
Yeah.
sex kit tracking initiative there, because we have had so many discussions over the last year or two about these with various stakeholders from all over the country, was it could actually assist the survivor in making that decision when they are anonymous, to decide that they know it's been sitting in this police department for a few years. They're finally deciding, because they do know what that status is, that they want to take the next step and maybe seek an investigation and possible prosecution. So there's so many different reasons, and obviously that doesn't pertain when it's a known kit that's being actively investigated, although it will still show, like yourselves from the hospital perspective, what happened with that investigation that we started in the kit. Where is it in the system? You would actually see maybe now it's at the crime lab, and that could mean that it was being examined, and we'll talk to Allison in a moment about how that works. From the hospital to the law enforcement. So yes, having worked in the city of Augusta, we obtained many anonymous kits that could have been from practically anywhere in the state of Maine if somebody simply went to Maine General in Augusta to have that exam done. And I was there when we were holding anonymous kits for only 90 days, and how the law has changed in just the last 4 or 5 years, bringing those kit holding times up to a 20-year mark now for these very reasons. And especially holding that evidence for some agencies could be a little bit of a challenge if they're a bigger place that needs more space. But also smaller agencies sometimes don't always have the ability to maybe hold stuff, you know, for longer periods of time. So if we can get things to the crime lab and process appropriately in a quicker time frame, or in a better time frame than maybe it had been in the past, that's always the best way to handle those things. So the law enforcement agency, regardless of whether or not it's anonymous or known, they will then take that sex kit, and if there's an investigation that can be started, they'll start the investigation. They'll be in contact with the DA's office per statute as well if they're investigating a sex crime, and then the decision gets made to transport the evidence, the sex kit box that Allison showed. And sometimes there's much more than just the box, because you may have collected clothing, or they came in wearing a blanket maybe, or it's wintertime and they have a big jacket, and maybe, you know, they came right from what happened to the hospital. So there could be a lot of different clothing and material like that that'll come in big bags and things of that nature. And everyone might not know this, but when the law enforcement agency collects this evidence, they're not bringing it back to open anything, because the hospital trained staff that do those exams will properly package and close and seal those items to ensure the chain of custody is held appropriately, so that it stays closed until it's brought to the crime lab. And only under those controlled circumstances that Allison can discuss will those items be officially opened. So the law enforcement agency, if it's just the box that Allison showed, will note the number on the box. If it's an investigation that has a victim, a survivor's name on it, we'll be able to use that to start the investigation, to either speak to them. Sometimes a law enforcement investigation starts before they go to the hospital, and then they're encouraged to go and have the exam. And then many times it starts with the person going to the hospital first, and then us being notified, because they do want a report done. So it can go many ways to get that investigation started. And then when the law enforcement agency responsible collects the evidence from the hospital, they'll bring it back, put it in their evidence locker. Many agencies in the state of Maine now are being accredited through the Maine Law Enforcement Accreditation Program, which is also actually managed by Dirigo through the Maine Chiefs of Police Association, with much input on policy development from the Maine Criminal Justice Academy. Everyone working in partnership to really help protect the rights of everyone involved in these types of cases. So those agencies that work through accreditation will have, excuse me, I'll take a drink. Those agencies, especially accredited ones, will have had their evidence lockers and their evidence storage areas, policy driven wise, held to the highest standard possible to hold that type of evidence before it can be brought to the crime lab. And especially the type of evidence we mentioned a minute ago, that certain sex crimes and assault cases can involve drug abuse or drug use that may need to be collected. So sometimes the nurses are collecting blood and urine, and those have to either be refrigerated or frozen. And those agencies that collect them have to have the ability to store those appropriately as well. And sometimes that's for quite a few months or years before they get brought to the crime lab, depending on the scenario. Everything would be reported appropriately by the first responding officer, and then the follow-up officers, or if a detective division is part of the investigation. So everything would be appropriately handled through the chain of custody until it's brought to the crime lab. And Allison, you can weigh in, I think, now maybe on how law enforcement agencies liaison with the crime lab to get the evidence brought, what the results can be given back to us to be able to respond to the DA's office, and maybe looking towards charges to the possible suspect. So what happens when law enforcement collects a kit that can be brought to the crime lab for evidence collection?
So if the case is a reported case, the kit can be brought to the crime lab for testing. And as Christian mentioned, oftentimes there's additional evidence brought in as well as the kit. So we might be also receiving clothing items, sometimes bedding items, items that might have been used for cleanup. There are numerous other things that can be submitted as well as the kit for evidence. And once we receive the evidence at the crime lab, it gets logged into our system, and then the tracking begins again. We prioritize cases here at the crime lab. Cases that involve crimes against people get top priority. Crimes against property would come below that.
Yeah.
Sexual assault as a crime against a person is high priority for us, and because of that, we try to keep as short a turnaround time as possible. So the cases are immediately flagged as something that's priority that we want to work on right away. And basically what we're looking for when we examine the evidence, it falls into two categories. First of all is biological fluids or stains, and second would be trace evidence. when I talk about biological fluids or stains, we're talking blood, semen, saliva predominantly. Trace evidence might be hairs or fibers or other kinds of debris that might have been transferred. In addition to biological stains and trace evidence, I'd also like to highlight an area that has recently been getting more coverage, more attention, and that would be looking for epithelial cells in the case of manual strangulation. So not only stains have biological fluid or DNA, but also transfer of skin cells from one person to another. So the kit has a bunch of envelopes. This is an oral swab envelope. And as Keri described, this might not necessarily be collected. If there's no indication that there was an oral assault, this may not be collected. If there was an indication of an oral assault, these swabs would be collected, and it would be indicated on the paperwork in the kit what might have happened, what the scenario was. Based on the kit paperwork, the forensic chemist makes a decision, sort of like a flow chart in your head, if you think of it that way. What's going to be done with that item? Because there's no way we could do everything that we could possibly do here at the crime lab on every item, because we'd never get anything done. So there's a decision-making process, and we rely heavily on the information that we're given. Basically, all of the swabs that are submitted in the kit go through a screening process, however, and we screen for the body fluids that I talked about, blood, semen, and saliva. If a screening test is positive, we'll go on to do a confirmatory test. So we have screening tests for blood, we have screening tests for semen, and we have screening tests for saliva. Once we get a positive there, we'll confirm. If we have a positive identification of sperm cells or semen, of blood or of saliva, those samples will be sent on to the forensic biology section for DNA analysis. After DNA analysis, we may have developed a profile, a DNA profile. And at that point, decisions have to be made about what can be done with that. In the case of the intimate body swabs, oftentimes, usually, those profiles are mixtures of more than one person. You would have the DNA present from the person that it was collected from, and also probably the DNA from the suspect. So there's a process where the DNA analysts have to deduce and decide whether or not the sample is CODIS eligible or not. So CODIS is the combined DNA index system, the DNA database. It's a national database of forensic samples and forensic knowns. If we develop an unknown DNA profile, that can be uploaded into the national database, and it can be checked against all of the known samples that have ever been put into that system from across the country. So why is this important? Well, rapists don't always stay in one state. They often travel from place to place. And somebody could have been convicted of a crime in, say, California, and then end up in Maine and commit a crime. If their sample is in the CODIS database, and we get a hit on that, well, we can go on to do an identification and then, hold the person accountable through the court of law. Not all samples are CODIS eligible. A lot of it depends on information that we get around the crime. I guess one of the things that we want to happen is we want to get as much information as we can into the CODIS system so that the chances of identifying these unknown samples is better.
Right.
And so I talked about biological fluids, trace evidence like hairs. In the past, we didn't do a whole lot with hairs because hairs were not identifying. In other words, we could do a microscopic hair comparison, and a hair could be said to be similar or dissimilar to another person or to a person. At this time, however, hairs, depending on what growth stage they're in, may contain enough DNA for us to be able to get a DNA profile from a hair. So a hair can be very good evidence. And if we're able to get a DNA profile from a hair root, that also potentially could be used to identify a suspect, either directly or through using CODIS.
Awesome. I'm just thinking in my head, that's pretty exciting though, when you get that.
Yeah.
Especially, you have a match. Once you've finished processing the kit to a point where there's nothing left for you to do, what usually happens? What's the next step that you guys take at the crime lab?
Once our report has been written and distributed, the evidence goes back to the evidence evidence receiving is what we call it, but it's also outgoing evidence. And the law enforcement officers will come and pick up their evidence and bring it back to their agency.
Yeah, and does the liaisoning work like they'll call you ahead of time, say we're bringing something in because you only accept it on certain days, or how does that work?
Yeah, that's not necessary, but it might be helpful. Evidence receiving is open on Monday, Wednesday, and Friday. So, it's not necessary to make an appointment, so to say, but if you do give us a call and give us a heads up, we can make sure that somebody's available and to take in the evidence.
That's perfect. Yeah, I know like CCU and Vassalboro has kind of a similar thing. Like they want to know ahead of time, but they have like 1 or 2 days or 2 or 3 days where they definitely take stuff. But it's always best to like call ahead and try to make an appointment or an arrangement so you guys are expecting it, especially if it's something, however the law enforcement agency is treating it, but to let you know, hey, I got a case here and I want to bring it right in and make that connection. Anything else from the hospital or the crime lab?
No, I was just thinking that you made a really good point when you were talking about that it's not always just like what can fit in the kit, like what fits in the box. I have packaged, and so has my team, some wild stuff as evidence, in correlation to crime. And it's not like sometimes it's really literally thinking outside the box. Like there's other things that can connect or have potential evidence that can corroborate a history. And I think like that's really important to note, and that safe nurses are trained on that packaging and storing and paper, no plastic, like
Exactly.
all of it. So it was,
and so from like I think a good last point today for us in this conversation could also be like the future of the sex kit tracking system that we should see in the near term, and how much that will benefit all of the stakeholders across the board, from the agencies that handle the kits to the survivors and their families, to know that something's happening. I think a lot of times it's always a question. Keri said the same thing. It's like she doesn't know what happens after they leave the hospital a lot of times. And at least in this way, there's that bridge or that connection that keeps maybe the information going about, is something happening? What's going on with the system, with the kit that's in that system? And I can tell you a quick story too. At least I know that as far as the anonymous kit tracking goes now, when you have the number and the survivor goes to any random hospital to have a kit done anonymously, that they go to any jurisdiction and make a report of the crime. I've seen that work where the NYPD has come all the way from New York City to get an anonymous kit that we were holding, because the person had their card and had their number, and the connection was made. So at least we knew, or we do know, that system does currently work as far as anonymous kits go. And that's because of that great number tracking system that's part of the Searchy repertoire of the way they have handled all the stuff in the evidence and the numbers that are attached to each one of those. So at least I have that experience, and now I'm very, very curious and excited, like all of us, to see how the actual kit tracking system will work, albeit remaining anonymous, but to show, you said a couple of hundred kits go out every year. Are they, how are they being processed and handled, and where do they go, and how many come through the system? Because Allison will see how many, excuse me, I got dry throat tonight, guys, I'm sorry. Allison will see how they come into the crime lab, but that number could be so old or new, or part of an old series that went out a while ago, that as long as the kits aren't expired, but then they have those expiration dates that the nurses will be looking at before they use them anyway. So it'll kind of be interesting to see, what goes out, what comes in, and where they are in the system.
I'm super excited. I can't wait.
I am too.
Yeah, that'll be very, very interesting. Well, I think that's great. On behalf of the SAFE board members here and our partners around the state of Maine, I appreciate you guys taking the time out of your schedules to have this conversation, which is recorded, and it will be available on YouTube in the future, and people will be watching this, I hope, to get a little info. And I'll put some contact information up in general terms that people could contact if they have any questions, or if they want to ask us anything more for future reference. So thank you very much, Allison and Keri, and we hope you guys have a good night. And this is Christian Behr from Dirigo Safety saying we'll see you guys next time.
Thank you.